So now can everybody hear us now? Okay.
Hi, Tana.
Hi, Dr. Creado. Sorry about that. We've been working on, it's a brand new format for me. So we're sitting here, I'm like, I can see you, I can hear you. How come you can't hear me? Okay, so here we are. Let me redo that. I'm sitting here thinking you are not on, but I was on and it was actually you on and not me on. So hello, everybody. Welcome. And I want to introduce a very special guest. This is Dr. Shane Creado out of our Chicago clinic at Amen Clinics. I just love Dr. Creado. He's amazing. He's not only a psychiatrist, but he's a sleep specialist. So he's a sleep medicine doctor, and he's also a sports medicine doctor. And your new book it's out now currently, correct? So
yes, it is.
Peak Sleep Performance.
Peak Sleep Performance.
Yes. Awesome. And then we also have a course that you're doing on sleep hygiene, because it's so important. Yes. So I really wanted to share you with my community. So welcome. Thank you so much for joining me.
Thank you for having me, Tana. It's an absolute pleasure as always. It's great to see you again.
Well, thank you. And our podcast that you did with Daniel and I on the Brain Warriors Way podcast did so well that it really made me realize that sleep is such a huge issue right now for everybody. So sleep is so important at all times because, I mean, obviously, that's when our brain washes itself, and you're going to talk about all that. But I feel like right now, even people who aren't normally anxious are super anxious. I know I'm not normally a person who's very anxious, but I've been really anxious during this time. The first part of the quarantine was fine. Then the social upheaval happened, and then the second part of the quarantine, and it was just a little too much. So we're seeing a lot more, right? Tell us, we're seeing more depression and anxiety, correct?
We're seeing way more depression and anxiety, 100-fold increases in anxiety, depression, prescription medications. And of course, everyone's sleep is messed up. Mm-hmm. A lot of people are working from home. Many people have lost their jobs, income. There's so many different worries out there, things within and out of our control. And that's the nature of sleep. Sleep is the most vulnerable thing we do. And if we're in danger mode, if we're worried, if we're anxious, it's going to be extremely hard to fall asleep. But the problem is, if we are sleep deprived, our resilience suffers. It's extremely difficult to think logically, respond appropriately when we are sleep deprived. Essentially, what happens to our brain when we're sleep deprived is what happens when we're drunk. The rational brain shuts down, the frontal lobe shut down, and the temporal lobe shut down as well. So the rational brain shuts down. We cannot regulate our emotions properly. We're more irrational. We catastrophize easier. And we see this on the brain scans all the time as well.
Right. So I'm curious I already know, it's so interesting to see people's brain scans when they have anxiety. So when people are anxious, their emotional part of their brain lights up, right? It like is on fire. Yes. And sometimes when they're depressed, it can either be on fire or it can be cold, right? It can either be really low or really high in activity. So what happens when you add sleep deprivation to anxiety or depression? What happens? What does it look like in the brain?
Fuel in the fire, right? It's fuel in the fire. So the basal ganglia, the stress responders are super active. And then the depressive circuits, the deep limbic system as well suffers too. And incidentally, that's the same area of the brain that's implicated in pain, the thalamus, your mood manager. All those areas suffer. And then when you're in danger mode, you can't fall asleep. Then you try harder, which makes it even more difficult for your brain to actually fall asleep. And then it just perpetuates a cycle of negative thinking around sleep. People are afraid to come around bedtime because they say, oh no, it's going to be one of those miserable nights I'm going to have, or tomorrow is going to be terrible. And so it becomes a self-fulfilling prophecy. And apart from the craziness of the world right now, women typically have way more insomnia than men do. And it tends to be, anthropologists suggest it might be because women tend to be more anxious. They care about people more intimately. They're more empathic. And so if you are more anxious, you care about people, then your brain's going to be wired in that direction. And we have busy lives, Tana. The one time we do have to ourselves and our brains and our own thoughts is around bedtime, unfortunately. And so that perpetuates a cycle of, oh, my brain says now is my time to worry about all these things I've been pushing aside during the course of the day.
I love that. And one thing you touched on that's really important, women suffer more from anxiety than men do. And one thing I wanted to ask you about, so you also mentioned that sleep is the most vulnerable thing we do. So if women suffer more from insomnia than men do, and sleep is the most vulnerable thing we do, and women tend to be more anxious than men are, that sort of makes sense to me, especially if you've been through any kind of trauma, right? So I would love to talk to you about past trauma and current trauma, how it sort of stimulates us in current trauma. But it seems to me like, as somebody who did deal with childhood trauma and trauma growing up as a young adult, young female, sleep is a vulnerable thing. So that would, seems to me like what you're saying makes sense. But now if you add to that the current situation and like how sort of frightened people are, I mean, it seems to me like women are going to feel more vulnerable to that if they already feel more vulnerable when it comes
Absolutely. Men tend to be larger, more muscular, stronger. Women tend to be more vulnerable innately because of the anxiety, the proclivity toward caring for other people. And then adding to that, they're less physically strong than most men. And especially if there's been trauma in the past, whether it's physical or sexual or emotional trauma, if that's occurred around the nighttime or even around the bedroom, then you're going to avoid the bedroom, or you're going to want to sleep with one eye open, so to say. So you'll have less stressful sleep. Your sleep cycles could be disrupted. That's not even counting what the impact of PTSD and nightmares and hypervigilance and easily getting startled, or those flashbacks that kick in.
it just makes so much sense to me. So how is it different when you, not everybody who watches my show is female, but we do have a lot of females who suffer with insomnia. So curious what you would tell them, and what would be the difference? Is it different what you would tell men and women, or is it the same? And what would you tell us to do?
It just depends on the person. There are a lot of guys who've been through trauma as well. And it's about tailoring our approach to the person's need. And that's what we've always done at Amen Clinics. So what I tell somebody who's faced trauma in the past is, if you're having active symptoms of frequent nightmares that disrupt your sleep, then it's a concern. If you are avoiding the bed or dread the nighttime directly related to that traumatic event, then it's a concern, and we need to look at PTSD, which needs to be treated first. Mm-hmm. But also, I encourage my patients who have any reason for being afraid of the bedroom, or afraid that night is going to be very bad, I encourage them to look at sleep as your mini vacation. It's your chance to get away from the worries of the daytime and kind of lock that in. Protect your sleep, protect your bedroom environment. That is your safe space. And if you don't feel it's your safe space, we can work on creating that safe space for you. If it means you need to check the locks in your doors twice, that's okay. If it means having a baseball bat under your bed, that's okay too.
Now you're speaking my language. Martial arts, baseball bat, whatever it takes.
Right, exactly. Just avoid keeping guns near your bed when you're going to sleep.
Oh, wow. Anyways, that's a whole other discussion.
And just near the bed, because if people take Ambien or certain other sleep meds, they're more likely to sleep talk, sleep walk, and do things that they might not be aware of.
So speaking of which, Ambien, that's a whole nother thing. So I know we've talked about to you on our podcast about how some of those sleep drugs can actually really make the brain not look too good on a scan, and what it looks like and how it affects people. I know about 15 years ago, I was prescribed Ambien when I was going through a divorce, and it was a really traumatic time in my life, very emotional. And it was so odd. The first day I didn't notice, I felt off and I didn't know why. I didn't put it together. And the second day I became bizarrely tearful. And I'm like, oh my gosh, the only thing different is this Ambien stuff. And as soon as I stopped taking it, it went away. But I've heard people say that Ambien can have weird side effects for them.
Yeah, it can have really weird side effects. And a lot of the standard sleep medications have a black box warning. The FDA says this is a dangerous medicine. So they're only supposed to be used in very low doses, for very short amounts of time, Tana, because the goal is to figure out what is causing the insomnia, what's triggering it, what's perpetuating it, rather than, oh, here's insomnia, so here's a medicine for you forever after. We don't do that with other things. We should not do that with other things.
Right.
If a car has hit you and you have a hip pain, you're going to get an x-ray. You're not going to assume that you need some Vicodin for it and get away with that.
Right. No, I agree. What are some other things people can do? I love what you're saying about the sleep hygiene. Fix what's wrong with your bedroom. I know I've heard you say don't make your bed for sleep only, or sleep and sex, you said actually.
Yeah.
So a lot of people will be relieved to hear that. But otherwise they're gonna have to be really creative. But anyways, but avoid bed and being in bed for other things like eating and television, and because then it makes it harder to go to sleep, correct?
Yeah, it's a simple psychological principle that goes back to something we call classical conditioning, where this guy Pavlov had these dogs he'd ring a bell, serve them a meal, then they'd be salivating. Then he'd just ring the bell and they'd still be salivating. So essentially, when you do all those things in the bed, you're associating the bed with all those activities. And when you actually want to sleep, your brain will think, well, which thing am I supposed to do now? Am I supposed to read? Am I supposed to work on my laptop? Am I supposed to watch TV? Am I supposed to schedule my worry time right now? And so it's simple psychological principles that we apply in cognitive behavioral therapy for insomnia. Insomnia is a lot of the time a behavioral issue. If we identify what we're doing wrong and also identify what we're doing right, change the things we're doing wrong, we're going to have a sustainable model to improve our sleep for the rest of our lives. And that has huge implications, not just for saying, yay, I'm managing to sleep better at night, but in terms of your hormone regulation, menopause, inflammation, your immune system, injuries, dementia, cancer risk, all those things.
I love that. What are some natural supplements that you have found that you really like that help people a lot?
Well, I have a lot of favorite supplements. I think melatonin is a great one. It's a very commonly available one, but it needs to be used in the right doses. So very low doses, maybe 1 milligram, 1.5 milligram, and 90 minutes before your desired bedtime. So you don't have that weird hangover effect the next day.
Yeah, I think that's going to surprise people, because I know I talk to a lot of women. I love melatonin, magnesium, that's my cocktail. But a lot of women that I know think they need to take higher doses. So can you sort of explain that?
Right. So melatonin rises at night when the lights are supposed to be dim. Kind of like our biological rhythm work in synchrony with day and nighttime. That's the way it's always meant to be. So melatonin rises at night and it nudges our brain into sleepiness. It's not supposed to knock you out. So even 3 milligrams of melatonin at night increases your internal levels to 10 times of what's considered normal peak levels. So melatonin needs to be taken 90 minutes before your desired time, only to help nudge your brain into sleepiness, not supposed to knock you out. A lot of people may make the mistake, Tanner, as you rightly said, taking really high doses because they say, wait, it's been 30 minutes or it's been 1 hour and I'm not falling asleep. Well, it needs more time, and you need a nice wind down routine before bedtime, before getting to the bed, because your brain is not a light bulb. It cannot just be switched on and off.
Mm-hmm.
So just like we have sleep cycles, we have wake cycles as well. It's important to have that fixed wake up time and a nice wind down routine before bed. So melatonin is one of my favorites. 5-HTP, which gets converted to serotonin, is another one. GABA is a great choice. L-theanine helps calm the nervous system down. Vitamin B6, those are some of my favorites. And magnesium, as you said. And we designed a great sleep supplement for Brain MD called Put Me to Sleep, which has all those important supplements in just the right amounts to help you calm your brain down, go beautifully into sleep, have your sleep cycles, and wake up refreshed in the morning without feeling tired or groggy.
And maybe another time we can do another live chat on some of those supplements, because I know it's really important to know your type. And the reason I say that is, for some people, 5-HTP and GABA, I mean, even during the day, it's just so beautiful for them. They love it. It calms them down. It's a little like, it just takes the edge off and they feel so good. I literally feel stoned. So but I also have sleepy frontal lobes. So I feel stoned if I take 5-HTP. And not that I would know what being stoned is like, but anyways.
Of course not.
but my husband loves it. He thinks it's great when I take 5-HTP because he likes when I'm super mellow. I don't like that feeling. I hate feeling like blah, like just like lethargic, and he's like, yeah, no, keep taking that stuff. But so it really does depend on your brain type though, right? Because
It does, and how sensitive your brain is as well.
Yeah.
If your brain is more sensitive, great, you might do amazingly at much, much lower doses than what are considered standard doses.
Right. Or you might like it at night, but not during the day. So for
Absolutely.
me, like taking it before bed might be okay. I cannot take it during the day and feel like I want to get stuff done. I just don't feel motivated. But taking magnesium with our combination, magnesium and the melatonin, it's just beautiful. It's just perfect. So everybody's different, right? So you have to know.
Yeah, and a lot of people make the mistake of looking something up online. Oh, GABA is good, or 5-HTP is good, or melatonin is good, and they take it at the wrong times. They don't know how to do it. They don't know if they have the right brain type for it, and what doses to take.
Right.
And that can be really, really bad, because then they'll say, maybe I need another supplement or another one, maybe a medication. And then at the end of the day, they're actually over-medicating, polypharmacy. They can worsen things like restless leg syndrome and sleep apnea.
And sleep apnea, that's a whole nother, so many topics we need to talk about. You're going to have to come back.
I'd love to, Tana.
Yeah, no, I love that. So we've talked about some practical stuff. The impact of not sleeping. We talked about how it can make you feel like you're drunk. And I know I did shift work for a while. I was a nurse. I was a trauma nurse. And for a very short time, I had to work nights. And I remember the day that it was really hard. And so the first thing that happens when you're a shift worker, for people who have to stay up all night, especially if you're not a night person, and I am not. I used to get up at 4 o'clock in the morning to work out. I was very much by nature a morning person. So when I all of a sudden have to stay up all night, and I have to stay up all night in a job where I'm afraid I'm going to kill somebody if I'm not paying attention, right? What do? You drink coffee all night. I was eating M&Ms, anything I could do to stay awake all night. And then it was just so painful. That 3 o'clock, 2 o'clock, time would come. And it was just so painful for those last hours. But I would get in the car to drive home, and there were several times I don't remember getting home. I just don't even remember it. And one morning I woke up, I snapped out of I had fallen asleep at the wheel and was headed towards the center divider. And I went into work and I canceled. I quit my job. I'm like, if you can't find me something during the day, I need to go work somewhere else. It was really sad. But it really has a huge impact on not just being drunk in the moment, but people's moods. Right. So talk to us about that.
Yeah. So as you were referring to, that there's over 6,400 fatal accidents in the US alone because of drowsy driving, and 36% increase in medical errors when medical staff are sleep deprived. So people are probably dying every single day. Patients are dying at the hands of sleep deprived physicians and medical staff, which is a tragedy. And yes, your reaction times will slow down. There was a study done that looked at reaction times of people sleep deprived compared to people who had various amounts of alcohol. And if you're sleep deprived for 4 hours, it's as if you've had 4 to 6 alcoholic beverages. There's actually studies that look at this stuff. 1 night of sleep deprivation drops your reaction time by 300%. So your reaction times will reduce, your ability to think rationally, to manipulate information, the processing speeds reduce, your executive functioning reduces, and your ability to deal with stress in a meaningful way reduces. So you go from responding to reacting. You go from rational to irrational thoughts. It's basically shutting your rational brain down and boosting your emotional overload there. So that's one important aspect in terms of how it impacts your brain health and your functioning, your reaction times. But your hormone levels will also be severely disrupted with sleep deprivation, and in way more increased risk of obesity in people who are sleep deprived. The hormone that regulates your appetite is not regulated properly, leptin. Your stress hormones increase, like cortisol, adrenaline increase. Your testosterone and growth hormone levels crash. So you'll be hungrier. For every 4 hours of sleep you lose, you'll think you need 900 more calories. There'll be more food cravings, more urges to engage in impulsive behaviors. And then everything you consume will kind of be rerouted toward fat accumulation. Then we know fat tissue converts testosterone to estrogen, and then that'll perpetuate further weight gain. So weight gain, high blood pressure, heart disease, inflammation, dementia, cancer risk directly associated with sleep deprivation.
That's really important. And I saw one study. I want to answer one person's question when we're done. But I saw a study that really affected me because as a nurse who was working nights and often doing double shifts, that was another fun thing. And the trauma unit, right? You get gunshot wounds to the head, and you're trying to focus, and you're working 20 hours, and I'm like, what am I doing? But I remember reading a study that they did on soldiers, and soldiers who got 7 hours of sleep, which I need more than 7 hours. I know that I need 8.5, but it's soldiers who got 7 hours of sleep every night. The average that's what the study was. They were 98% accurate on the range the next day with weapons. But if they got 6 hours, one less hour of sleep, it dropped their accuracy by like 28%. And then 5 hours was less than 50%. 4 hours was like 15%. So it was crazy. Like 4 hours was like they were dangerous. But I mean, 50% is pretty dangerous too. So I argue that's pretty bad. 2 hours less of sleep made them dangerous on the range. So it's really important. And there's one question here from Heather, and she wants to know what she can do to prevent or to stop waking up in a panic in the middle of the night. So if she goes to sleep and she's waking up in a panic post-trauma, so some traumatic event, waking up in a panic. So what she's been doing is going to bed after midnight and hoping that works. But the problem is she then wakes up tired anyways.
Okay. So if it's directly related to trauma, and if the trauma was at night around the bedroom, that needs to be dealt with in terms of evaluations for PTSD, and then doing things like EMDR, trauma-focused CBT, to first of all reduce those symptoms. Now, of course, she can also things in her hand, make sure the bedroom is a safe place. She's locked her doors, and then she knows that it's safe. She has a bed partner who's there, who is a protective person, presence in her life. That's also going to be good. But I'd say work on wind down routines that involve meditation and calming those emotional circuits down. So if it means meditation, sleep stories, that's great. Do it. You'll be able to fall asleep okay. And if you are waking up in a panic, that's okay. Get out of bed, read a boring book, listen to some meditation again. Whatever meditation works best for you, keep practicing that. Once you're calmed down again, then get back to the bed. Because if she's waking up in the middle of the night in a panic and then staying there in a panic, sweating, anxious, then she's associating the bed with worry, with anxiety. And then at night when she's supposed to go to bed, she's already going to be dreading that. Because now the bed is a place of danger and anxiety, not safety. So getting out of bed, doing something relaxing, then going back to the bed helps break that cycle over time.
I like that a lot. I don't know what your thoughts are on this, but the idea of sort of being afraid to go to sleep, I know that's very common for adults, and sometimes I think that starts in childhood. So my new book coming out in January is called The Relentless Courage of a Scared Child, and it's about overcoming, trauma, anxiety, and grief, and basically in life, and not being a victim to it. But as a child, I was a latchkey kid. I was home alone a lot. And terrified. Some like bad stuff happened in my house growing up. That happens to a lot of people. I'm not unique in this. There's a lot of latchkey kids, a lot of people who grow up poor, single working mothers. It's a common thing. But one thing I had, and my mom, someone would have called CPS on her now, but I loved it at the time, was that we had a big German Shepherd that I just loved. And there's something, I still have a thing about these dogs, about I need to have a big dog in my house. I just love having big dogs. I don't know what your thoughts are. Have you noticed that pets help people sleep better, or having a dog in the house helps people settle their anxiety, or is that not a good thing?
Oh, you've lived through that, so you know it's been helpful for you. And that was your anchor. Despite the stormy sea of your life, despite what's happening there, that German Shepherd was your anchor. That was your safety. That was essentially your safety blanket. So nothing wrong with a safety blanket.
Predictable. Yeah, I say he was the most predictable, consistent male in my life. So,
Don't tell Daniel that.
no, not now, but then when I was a
Not
kid.
now. Good. So if people feel that a particular dog, a pet is really helpful for them to feel safe and fall asleep, that's great. But if you have a rambunctious dog jumping up and down and disrupting your sleep, it's not a good idea.
Right, right. No, I keep my dog in the room, but not on my bed. So I still have to have big dogs. It drove Daniel crazy when I met him. I had this monster of a dog. He's like, that's just a little too big for me. We can go back to a shepherd, but that's about as big as I can go. So
Right.
it made me feel safe about it. Just as sort of a side note, because I wonder if for some females that can be a comforting thing. If they're alone, they live alone.
If it's comforting and the pet is on the floor or in the bed but doesn't disrupt your sleep, by all means, go for it.
Okay, so my thought, I just want to see what else everyone is saying. Oh, someone said congratulations on the book. Thank you so much. Before bed, she loves doing prayer, meditation. Me too. I do prayer, meditation, and grounding, which is what you were just talking about.
Yeah.
I know light therapy. She said light therapy. And also I know a lot of people like those diffusers for aromatherapy.
Yes.
Any evidence of that working, or is that more of a personal thing?
Lavender. Lavender can be particularly helpful.
Okay, good. Excellent.
Yeah.
I think we are actually, are we close to the end of our time? We are close to the end of our time, and it feels like it went so fast. So could I have you back? Because I feel like there's so much more to talk about.
I'd love to, Tana. Thank you so much for this opportunity. Congratulations on this new series. I think you're going to reach so many people and help so many people. Building resilience is what life is all about. Thank you for your time.
Creado. So we have about 1 million topics on sleep, and it's one of the things I've done a ton of blogs about. I'm like literally, I'm so high maintenance when it comes to sleep because I'm so serious about it. But there's so many things. It's not just trauma, anxiety, which is what we're focusing on right now, but there's medications people take that affect their sleep. There's, I mean, we could go on and on and on, like me being high thyroid, or people who are on heart medication, or there's so many things we need to address with sleep. And so I would just love to welcome you back if we could do this maybe again in a month.
Sure. Sounds good to me. There's a lot of misinformation on the internet as well. Sleep hygiene does not work for every single person. I advise strategic napping to many of my high performers as well. So strategic napping is extremely beneficial, whereas sleep hygiene says avoid naps at all costs. So there's a lot of misinformation out there. I think you will be a great person to advocate for sleep and understanding exactly what is right and what is wrong, and how to help people navigate various problems that overlap with sleep, like Parkinson's and mental health issues.
Now, I know your course, that they can find your course at Amen University, right?
Overcoming Insomnia is the name of the course.
And I know it goes really into depth about everything we're talking about and about 100 times more. And also your book, Peak Sleep Performance.
Peak Sleep Performance for Athletes.
Yeah. Oh, that's more for athletes. Okay.
It's all the skills I use with my athletes on optimizing their sleep that's available to anybody to access. So it could benefit anybody and everybody.
Okay. So just for everybody listening and watching, if you're having trouble with sleep or you know someone who is, and this is really affecting your life, Dr. Creado is just an amazing human being. He's one of our doctors at Amen Clinics. He's out of our Chicago clinic, and you can find him there. And please check out his course on Amen University. You can go to our website, go to Amen University, and find him there. So thank you so much, Dr. Creado. As always, it's just always informative and a pleasure.
Thank you, Tana.
Thanks, Doc. Just we go out here.